Hi, my name is Alicia, and I'm here to discuss a topic that I've been recently reading articles about transgender in a medical facility or healthcare. Transgender could be male to female, or female to male, or non-specific transgender. The time frame from the early 2000s to now has had a dramatic change on transgender and how healthcare looks at transgender. When transgender first became a big population within the healthcare systems, a lot of people didn't know where to go. They didn't know what doctors to choose. They didn't know how to go about asking for help on hormone replacement therapy. They had no clue on which professions in healthcare could actually help them. But from then till now, healthcare with transgenders has really peaked. It's really taken a different toll. Because back in the late 90s and the early 2000s, a lot of people wouldn't be seen because they were transgender, just because the physicians didn't know how to handle them, how to treat them, how to answer their questions sometimes, or even they felt even uncomfortable with having to talk to them. Transgenders were getting discriminated due to wanting to either become male to female or female to male. Now, male to female means that they would have to take female hormone replacements. With that, they would need extra monitoring and guidance. And a lot of regular family practices wouldn't do it. They would have to go to big universities. And a lot more people are understanding that it's a lot more common now, and it's a lot more understanding than it was back then. A lot of transgenders would get discriminated at the front door. I mean, if they walk up to the receptionist or even on the telephone, if they figured out what they were or who they were or their gender identity, as they call it, it doesn't really matter now. Now, they're more worried about keeping them stable, getting the right treatment, the correct treatment, so they don't end up getting sick. They don't end up harming themselves or hurting themselves by the improper healthcare treatment. A lot of transgenders wouldn't go to the doctor, or they would wait forever and ever and ever till they got to the point to where they couldn't stand it before they went to seek medical help, just because they were afraid of how people would look at them, treat them, talk to them, and observe them. Whenever this happens, a lot of people in the whole office are that way. I've seen it personally and firsthand in doctors' offices because I actually work in a family practice. I used to work for a physician that actually did that. Instead of asking what she needed help with, or what this, or what therapy, or where could we, help her get into, she just said, I can't help you because I don't know how. Instead of actually trying and physically putting effort into the help that this patient needs. Now, I work for a great clinic, a great society of healthcare people that we strive to help anybody and everybody, even transgenders. We go beyond and be above to try to help them get the hormone placement therapy they need. If they want to have the sex realignment surgery done, we work on finding places that accept their insurances and whatnot. Back in the late 90s, early 2000s, that was frowned upon between none other. Now it's just another day in a life. So thinking back and looking back at the statistics and the articles from the late 90s, early 2000s to now, there's been a big society change within the healthcare family society. It's gone from little knowledge to strides and boundaries of knowledge for transgender families, friends, and the community. Support groups within the healthcare facilities are amazing these days. So I hope that gave you just a little of information about transgender within healthcare. Thank you.